Hello, I'm Dr. Deborah Wilson. I'd like to talk to you today about menopause. This is a big subject. So what is menopause? When a woman is in her reproductive years, her ovaries are producing estrogen, testosterone, progesterone in a cyclic manner, and that's causing periods. But when she reaches late 40s, early 50s, the average age of menopause is 50, the ovaries stop working. Basically, they stop producing estrogen, progesterone, and testosterone. And that has significant implications for women. What are the symptoms of menopause? Hot flushes, night sweats, mood swings, depression, insomnia, vaginal dryness, pain with intercourse, joint pain. It really goes on and on. There are women whose lives are altered by these menopausal symptoms, and they're not sleeping at night, so they don't function well during the day. They're having hot flushes, which are quite distracting. They're having night sweats. They've got to get up and change the sheets. It really is an impactful experience for them. The only really effective way of treating menopausal symptoms is to replace hormones. If a woman goes through menopause, goes through her later years, and does not elect to replace estrogen, she's almost certainly going to lose bone. And at a certain point, she will develop osteoporosis, and osteoporosis is dangerous. So if she falls and breaks her hip at age 72, that is a life-changing event. Also, estrogen preserves cardiovascular function. So a woman who is going through menopause and not using hormone replacement will have a higher chance of developing coronary artery calcification, which leads to heart attack, stroke, etc. And also, taking estrogen actually increases one's sharpness and enhances memory. And it looks like taking estrogen in the menopausal later years prevents Alzheimer's disease and dementia. So these are more silent effects of estrogen. So I have women come in and say, well, I'm not really having any hot flushes or night sweats, or I'm not really suffering with menopausal symptoms. But I always like to talk about some of the more silent benefits of taking particularly estrogen. Testosterone we often combine with estrogen because in the premenopausal state, the ovaries produce both testosterone and estrogen. Testosterone increases energy level, increases ability to build muscle strength, and also enhances sexual desire, arousal, and orgasmic capacity. So women are much more open to hormone replacement therapy these days. In fact, they are begging for it these days. We are deluged with patients who want to start hormone replacement therapy. And I'm thrilled, actually, because these women are going to be much healthier in their older lives. So if you're having menopausal symptoms or your periods have stopped and you are menopausal, come in and have a consultation with one of our physicians or our nurse practitioners, and we can talk to you about the benefits, talk to you about the options that are available. There are many, many options. There are creams and gels and pellets and sublingual drops and sublingual troches. So lots and lots of options for treating menopausal symptoms and treating women who are menopausal. Even if you don't have symptoms, there are quite a few benefits to be gained.